This evening, we are continuing to keep a close eye on the measles outbreak. Just a few hours ago, the Houston Health Department announced the 2 suspected measles cases in the city tested negative. Word came after the city hosted a free vaccination clinic earlier today. Our Michelle Choi spoke with Houston's chief medical officer about why vaccination is key.
Among those who stepped in and took advantage of Saturday's vaccination clinic at the Sunnyside Health Center, which was free to those who qualified, included 70-year-old Helen Kraft.
How concerned have you been watching the news and seeing that there is a growing number of cases?
It breaks my heart.
With a new family member on the way, she shared it was important to her to get the measles vaccine.
I'm going to be with my newborn baby, grandbaby, and I'm supposed to do this for not only him, but for myself.
This comes as the Texas Department of State Health Services confirmed 146 cases of measles since late January, all tied to a growing outbreak in West Texas, where earlier this week a school-aged child who was not vaccinated died.
This is absolutely not the time for anybody to panic or, overreact. This is the time for folks who think that they are not vaccinated or know that they're not vaccinated to go ahead and get vaccinated.
According to Houston's Chief Medical Officer, Dr. David Persse, there are currently no active measles cases in Houston and Harris County, but he stressed vaccination is the key to getting a handle on the growing cases.
Measles is extremely contagious. For every one individual who's infected with measles, if they were to go into a room full of people that were unvaccinated, you can expect 12 to 15 of those folks to become ill.
He says the virus can also linger in the air for about 2 hours after someone with measles leaves. Among those most at risk, people who have compromised immune systems and unvaccinated children. He says the recommended age for the first dose of the vaccine is between 12 to 15 months. But if you live in an area where there is an outbreak, he says your baby may be able to get vaccinated early, so it's best to talk to your pediatrician. And for those who are unsure if they're vaccinated, he says there are 2 things you can do.
Either way, you can either find out if you were vaccinated as a child, there is a blood test for that, or you go ahead and get vaccinated.
In Houston, Michelle Choi, KHOU 11 News.
You can find more information on how the virus spreads and the recommended vaccine schedule on our website, khou.com. Just text the word measles to 713-526-1111 and we'll send that information right to your phone.